Hello, my name is Berenbrok. I'm an assistant professor here at the University of Pittsburgh School of Pharmacy, and I have a focus in community practice and research. So a little bit about myself. After I graduated from Pitt with my PharmD, I did a one-year postgrad at UNC and Walgreens. So I was trained in community pharmacy, and that's where I focused my time here at the school. And so Amir asked me to share some type of solution or some type of problem that is current in practice, and I think I have one of those for you today to work on. And that is the limited information that we have at community pharmacies when dispensing medications, how we can expand that to indication, safety, and effectiveness outside of the world of adherence in which we primarily live. So right now the issue is that at community pharmacies the only data that we have is data that we generate ourselves or data that we get from patients directly, with very limited opportunity to access the electronic health record, and there's very limited trials or community pharmacies that have been successfully able to integrate the EHR into the dispensing software. And so right now, community pharmacists, when dispensing medications, get DURs or drug utilization review flags when dispensing, which are primarily focused on safety, drug-drug interactions, using the data, of course, that we've already generated through dispensing of other medications, and then also adherence. So if a patient's not adherent or late for a refill, we can use that. Again, data that already exists. And so wouldn't it be cool if we can get access to the indication for the drug, and also how the patient's doing on that drug. For example, if a patient's prescribed a really common old medication called amitriptyline that has about 10 different indications, we can actually see what the patient's using it for, so we can make sure we monitor the patient and make sure that they're getting the most out of that medication. Surprisingly, prescriptions that come to the community pharmacy don't have to have a reason on them, and very rarely ever have an indication written by the prescriber. Two, what if a pharmacist was dispensing a medication for a diabetes medication like metformin and could see an alert that said the patient's blood glucose is trending down, or the A1C is trending down? Or the opposite might be true, a patient's on a medication for blood pressure and the alert says that the patient's blood pressure is trending up, and then the pharmacist can have that conversation with the patient and then adjust therapy with the prescriber. So just some thoughts to think about how we can integrate our current DUR system or drug utilization review alerts and then incorporate things beyond just drug-drug interactions and adherence to indication, effectiveness, and safety. There's some other things that are already going on in this world, like connections to the EHR, and then also drug lab interactions within long-term care facilities. But I think this would be a really cool thing to give more information to community pharmacists so they can better take care of patients at the point of dispensing. So thanks for listening to the video and taking a little bit of that idea into your practice, and hopefully you can come up with a great solution that can change the world. Thanks.